Chapter 33, Treatment of Fungal Infections. Fungi are organisms similar to plants, but they lack chlorophyll and the capability of producing mycotic, which are fungal infections. Thousands of different fungi exist. Mold, mildew, yeast, and mushrooms are all type of fungi. Many fungi are beneficial and do not cause disease. For example, some mushrooms and fungi are edible. The antibiotic penicillin is derived from a mold, and yeast causes bread to rise. Other fungi can cause severe illness like pneumonia, individuals who have decreased immune system response. And there is the Aspergillus fumigatus, a mold that causes serious respiratory infection. The general term used to describe a fungal infection is mycosis. Most fungal infections of the skin are caused by a group of fungi called dermatophytes. Dermatophyte infections are common and affect up to 20 to 25% of the global population. This is because fungi are ubiquitous, found everywhere. They're found in air, soil, plants, and water. They're also found on surfaces in the home, office, school, gym, and even occur normally on our bodies. Fungi that are part of the normal body flora may become pathogenic, cause infection, only when the normal balance of flora is upset. For example, women who take broad spectrum antibiotics may get a yeast infection because the bacteria and fungi that keep the yeast that are normally present in the vagina from overgrowing are killed by the antibiotic. So that's why you'll see a lot of women when they're getting their antibiotics, the doctor has already called in a prescription for a yeast infection along with it. Fungal infections caused by the dermatophyte tinea are named for the site of infection. For example, tinea manis is a fungal infection on the hands. Tinea corporis is an infection on the body. And tinea capitis is located on the head, hence cap. Tinea infections are also commonly called ringworm. Ringworm is caused by fungus, not a worm, as the name implies. Athlete's foot, tinea pedis, is a common fungal infection that affects athletes and non-athletes. So some of the symptoms can be peeling, flaking between the toes, redness, itching, burning, or stinging. And there is figure 33.1, an athlete's foot. That looks very painful. Is severe, it may cause cracking of the skin, oozing, and secondary bacterial infections. Box 33.1, prevention of athlete's foot. Keep your feet clean and dry. Dry between your toes after swimming or bathing. Wear leather shoes or sandals that allow your feet to breathe. When indoors, wear socks without shoes. Wear cotton socks to absorb sweat. Change your socks twice a day. And just a little note, white socks do not prevent athlete's foot. I've never heard of that besides in this book, but hey. Use talcum or antifungal powder on your feet. You should allow your shoes to air for at least 24 hours before you wear them again. And remember to always wear sandals in public pools and showers. That's really good. Important when you're at the beach or at a swimming pool, even at outdoors at other people's houses. Ringworm infections are caused by tinea fungi. Ringworm can also spread between humans and animals because it is contagious and spread by person-to-person contact physically with infected surfaces or lesions. Cats and dogs may be carriers of the fungus. A ringworm of the body is also known as tinea corporis. Patches and plaques appear pink to red with raised scaly borders. They form in a distinctive circular pattern that gives the name of ringworm. So figure 33.2 shows you what a ringworm lesion looks like. Tinea capitis is also called ringworm of the scalp. It occurs more frequently in children than in adults and is spread by sharing contaminated hats, combs, clothing, bedding, and linens. It may also be spread from animal to person. The fungus can cause bald patches on the scalp. And there's Tinium mandis affects the hands and Tinium unguum affects the nails. Infected nails become discolored and thick and may crumble or fall off. Onychomycosis is the fungal infection of the nail. It's hard to treat with topically applied antifungals because it is difficult for the drugs to penetrate the nails and skin bed. So figure 33.4 shows that. Frequent removal and replacement of artificial nails can cause thinning of the nail bed, increasing susceptibility to the onychomycosis. Candida, also called yeast, is a type of fungus that thrives in moist, warm areas and can cause fungal infections in the vagina, groin, penis, skin folds, corners of the mouth, and nail beds. Candida is normally present in the GI tract and vagina, but causes infection only when conditions are favorable for the overgrowth of yeast. Vulvovaginal candidiasis is also known as yeast vaginitis. Changes in hormone levels, age, pregnancy, taking oral contraceptives or hormone replacement therapy can increase the risk of this infection. Facts 33.2 shows the risk factors for vulvovaginal candidiasis. So age, decreased immune status, diabetes, drug therapy like hormone replacement therapy, oral contraceptives, antibiotics are a big one, immunosuppressants, and corticosteroids. Douching, diet, menses, pregnancy, sexual activity, stress, and tight-fitting clothing and synthetic underwear. Signs of vulvovaginal candidiasis is itching, cottage cheese-like vaginal discharge, burning, and pain during intercourse. Candida can also cause infections in the oral cavity in the area surrounding the mouth. A candida infection in the oral cavity is termed thrush. Thrush is most common in infants, but a thrush infection in an adult is a sign that the immune system is compromised. Thrush is an opportunistic infection that occurs in individuals with diseases that affect the immune system, such as HIV, persons who are taking immunosuppressive medications for cancer treatment or after stem cell and organ transplantation, and also with individuals taking broad spectrum anti-infective agents. There are three primary mechanisms of action for antifungal agents. Most antifungal agents act by destroying the fungus cell's membrane. A second mechanism is interference with the synthesis of nucleic acids needed for replication. A third mechanism is inhibiting the synthesis of the fungal cell wall. Some fungal infections can be treated with non-prescription antifungal agents. Ringworm, vulvovaginal candidiasis, jock itch, athlete's foot are examples of fungal infections that are cured using over-the-counter drugs. Onychomycosis and systemic fungal infections must be treated with prescription antifungals. Imidazoles and triazoles are formulated for the treatment of cutaneous skin fungal infections and systemic infections. Clotrimazole and miconazole are topical imidazoles that are available without prescription in the United States. Fluconazole, ketoconazole, and tioconazole are OTC antifungals that treat athlete's foot, vulvovaginal candidiasis, jock itch, ringworm, and oral candidiasis. The remaining imidazoles, econazole, oxyconazole, sulconazole, and sertraconazole are restricted to prescription use. Fluconazole, itraconazole, posaconazole, teraconazole, and voriconazole are also all triazoles, and they all require prescription. The imdazoles and triazoles interfere with ergosterol, an essential component needed for the synthesis of the fungal cell membrane. We have a chart here with the different dosage forms and strengths for the imdazoles and triazoles. So butaconazole, the brand name is Gynazole 1, and it's available as a vaginal cream. Clotrimazole, we have all of these different brand names, and then we have all of these different dosage strengths or dosage forms and strengths. So we have a topical cream, a topical solution, a vaginal cream, a vaginal tablet, a vaginal tab and cream, and a troche, which is like a lozenge. And econazole, we have a cream and a foam. Fluconazole, we have the capsule that comes like in the little card, that's 150 milligrams. Then we have powder for oral suspension, injection solution, and then there's 50, 100, 150, and 200 milligram tablets that come in regular prescription bottles, not on a card. And then you can see with the rest of them, we have quite a few different dosage forms. Miconazole is a big one. There's so many different dosage forms. So we have a cream, a lotion, we have ointment, we have buccal tablets, we have powder, topical powder, we have sprays, we have powder sprays, we have vaginal cream, we have vaginal suppositories, and we have vaginal suppository and cream. Those come in the monostack, like dual pack or combo pack. And then for some of the other ones, like Urtaxo, the sertraconazole, there's only available in a cream. Vagistat 1 is only available as a vaginal ointment, but it's over the counter. And this chart also does show you what is prescription and over the counter, so it's kind of nice. Butanafine, naphthafine, and terbinafine are classified as alilamine antifungals. Lamisil is effective for treating fungal infections involving the nails. Alilamine antifungals inhibit the synthesis of the cell membrane of susceptible fungi by blocking an enzyme needed for the synthesis of ergosterol. Butanafine and naphthafine are only available for topical application. Terbinafine is formulated for topical and oral use. So there is an oral tablet. Terbinafine is fungicidal. It kills fungi, where azole antifungals like clotrimazole, miconazole, which we just talked about, are only fungostatic, which means they just slow the growth of fungi. So then we have our chart with the alilamines, all of which we just talked about. You can see that the terbinafine, the Lamisil, is available as a cream, 250 milligram tablet, spray, and topical solution. Nystatin, niatomycin, and amphotericin B are derived from the fungi-like bacteria Streptomyces. They belong to the class of antifungals called polines. Nystatin is used for the treatment of candida infections on the skin and mucous membrane. Nystatin suspension is commonly prescribed for the treatment of thrush. Amphotericin B is prescribed for systemic infections caused by various fungi, including candidiasis, histoplasmosis, and aspergillosis. Natamycin is used to treat fungal infections of the eye, which we talked about in chapter 15. Natamycin, nystatin, and amphotericin B inhibit the synthesis of the fungal cell membrane by binding irreversibly to ergosterol. Nystatin is available only for oral and topical use. And we have our chart with all these medications listed. You can see that nystatin is cream, tablet, ointment, powder, oral suspension, and vaginal cream. And then we also have some combination products with nystatin and triamcinolone. And the amphotericin B is only available as a injection or IV. Sulfonate is the only antifungal belonging to the thiocarbamate class. It is approved for the treatment and prevention of athlete's foot. It is also indicated for the treatment of ringworm and jock itch. It is available without a prescription. So you can see all the different dosage forms of that as well. Cream, spray, powder, solution. Anadulafungin, caspofungin, and micafungin belong to a class of antifungals called echinocandins. They are effective for treating infections caused by Candida and Aspergillus. A common ending for these antifungals is fungin. They interfere with the synthesis of the fungal cell wall. They are not toxic to human cells because their target is a cell wall component that does not exist in human cells. Oral absorption is poor, so it is formulated for parenteral use only. So you can see the three of them, and they're all available for powder for IV infusion only. Cyclopirox and undisclenic acid are effective for treating athlete's foot and jock itch. Cyclopirox is a broad spectrum antifungal agent and is also approved for the treatment of ringworm and mild onychomycosis. Griseofluven is an orally administered drug used to treat onychomycosis. Povidone iodine is used to treat thrush and is also used as an antiseptic wash, orally and topically. Cyclopirox, povidone iodine, and undeclinic acid are topical antifungal agents. Cyclopirox interferes with DNA and RNA synthesis. Griseofluven interferes with fungal mitosis. And griseofluven formulations made with ultra micronized crystals, GrisPeg, offer the best absorption. Absorption is also increased when the drug is taken with a fatty meal. So we have our miscellaneous antifungal agents listed here. For the Loprox, you can see it comes in a cream, lotion, Penlac is the nail lacquer, and then the shampoo. Povidone iodine comes in a douche, an ophthalmic solution, scrub cleanser, solution, spray, and sponge. Now we have the summary of the drugs used for the treatment of fungal and yeast infections, which we've went over all these, but we do have some warning labels. All of these here should be completed throughout the whole course of therapy. So you don't want to just like with an antibiotic, just take it until you see results and then quit because it will come back. For the suspensions, of course, we're always going to shake well with suspensions. For itraconazole and voriconazole, we should take with food and avoid grapefruit juice. Ketoconazole should be avoided with alcohol and it should be taken with food. Same with posaconazole and voriconazole should be also taken without alcohol. Vifen, voriconazole should be taken on an empty stomach. The allylamines, all of them should be completed. The full course of therapy should be completed. Terbinafine should be taken with food. For the polines, we have Protect from Sunlight. That's the IV solution of amphotericin B. Should be refrigerated as well. Shake well, natamycin. Complete the full course of therapy, natamycin, and also shake well again with natamycin. Thiocarbamates, complete the full course of therapy. The echinocandins, we're going to refrigerate, do not freeze. To mix, gently swirl, do not shake. That's for the micafungin, and it may be stored at room temperature for 24 hours. And for the miscellaneous agents, we're going to complete the full course of therapy. Griseofluven we should take with food, and cyclopirox should be shaken well, the lotion should be.